Hello everyone, my name is Dr. Manav Manchanda and I am a consultant in the field of respiratory critical care and sleep medicine. I am working in Asian Hospital Faridabad and I have my own clinic at Sector 16 Faridabad. So the topic that we are going to discuss today is about sleep disorders, particularly obstructive sleep apnea. Now sleep disorders are very common in our population. About 10% of our population has this problem going on at some point of life. Obstructive sleep apnea is a very common form of sleep disorder and there are estimates that about 3 to 4% of patients do have this obstructive sleep apnea. The risk factors for a person having obstructive sleep apnea is basically whether the person is overweight, when he has a thick neck circumference, or dietary factors like when he has increased alcohol intake or when he is a heavy smoker. These are the commonly risk factors when a patient develops the disorder of obstructive sleep apnea. Now the common symptoms that these patients they present to us is basically the patients present to us with daytime sleepiness, even during daily activities, like a person is watching TV, he dozes off, or sometimes the problem is so severe that a person is driving the car and he sleeps off, and this can lead on to fatal accidents. The other common thing that the patient comes is usually the spouse complains of that the patient is having increased snoring activities during the night and even very loud snoring, though the spouse is not able to sleep, and they may complain of that the patient is having choking episodes while during sleeping. Now this is the symptoms that usually the patient complains or the spouse complains and the patient comes to us, so we can then further test out for these patients. Now the common problems that these patients land up into is basically they can have, this is a root cause for various disorders like diabetes, hypertension, heart attacks, brain stroke attacks, decreased virility, loss of daily activities, and the patient is having a sedentary lifestyle, so that further he gains weight and the cycle goes on like this. Now basically how do we test this out? We do a procedure called as a sleep study. Mostly this patient is subjected to sleep study in hospital, where we have a machine which tests out for these disorders. It is like an ECG machine where we put in electrodes and the patient can test out the problem. It can be done at home also, but we always prefer to get in a hospital because mostly the parameters that are studied in hospital cannot be studied at home. We test out various parameters like snoring activity, the limb movements, the leg movements, the activity of the brain, the activity of the eyes, and the activity of the muscles during sleep. And according to this report, then we can prescribe various therapies to this patient. Now, why this problem is causing so much of strain in the body? Because the sleep is a function of the body which is very important to give rest to all the organs. So when the patient is not sleeping properly, that is when the patient is having this obstructive sleep apnea, amount of oxygen that goes into the body is very less, and that creates lot of stress on all the organs of the body. So the function of the sleep, that is to make every organ rest, is not provided because of lack of oxygen, and hence the organs are under continuous stress and they then lead on to various disorders that I have just discussed. So what is the treatment for this problem? The treatment basically consists of, first and foremost, is lifestyle modification, and most of important component of that is weight loss. Every patient should be asked to do any regular activity so that he loses weight. If he is smoking more or drinking more, these should be withdrawn and stopped completely. Next comes the role of CPAP machine. CPAP machine is a common device which is offered to these patients for obstructive sleep apnea management. It basically consists of a mask-like device where the patient applies this mask during sleep, and after the application of this device, the oxygen goes properly into the body. And these machines come in various small sizes and they are very compatible to carry around now. And the masks are also available in various sizes from which the patient can choose according to his own comfort. So in nutshell, I would say that this disorder is a very common disorder, and I hope my talk will increase the awareness of this disorder in general population, so that they can come to their physicians earlier and get a proper treatment for this problem. Thank you.